we have given the scenario that 25 years old female patient undergone laparoscopic cholecystectomy, and the operative time it was 2 hours, and we have given a command to calculate the post-operative fluids. So now proceeding, we have given the information that the weight of the patient is 45 kg. Okay, and the pre-operative the status of the patient, in which we see about the HB level, we see about the hydration and sodium and potassium, it's normal. Okay, and the per-operative status maintenance fluid, it was 40 into 45, the weight is 45, and the value it comes out to be 1800. Definitely it's for the 24 hours, and we will divide it by the 24 hour to get the fluid requirement in 1 hour, and the operative time was 2 hours, so we will multiply it with the 2. The value will become 150 ml. Okay, and third space loss, we are considering it as a moderate incision, and definitely in the previous section we have studied for the moderate incision it's 3 to 7, so we are taking the value 7 ml per kg per hour, and we will multiply it with the weight of the patient, and as we require for 2 hours, so we will again multiply it with the 2, so 630 ml will be there, and ongoing blood loss it's nil, and the blood loss it's also nil. So the total fluid per operative 630 plus 150, it almost comes out to be 780 ml. That's the per operative fluid he will require. Now we have given the command of calculating the post-operative fluid. So for that purpose you must know the duration of the NPU. In this case we will keep the patient NPU for 4 hours. Okay, and the maintenance fluid, it's the weight into 40, definitely it will come 1800, and it's for the 24 hours, and we will divide it by 24 to get the fluids in 1 hour. As we require the fluid for 4 hours, so we will multiply again that value with the 4, and it will come almost 300 ml. So the post-operative fluid will be 300 ml in this patient in 4 hours, and the electrolyte sodium, definitely its value is 1 milliequintal per kg. So for a patient of 45 kg it will be 45. We will divide it by the 24 to get the value in 1 hour, and we will multiply it by 4 to get the value in 7.5 in 4 hours. But again the golden rule, it should be low in sodium, there should be no potassium, and it should be low in volume. So finally after the roundabout we will give the 280 ml in 4 hours, and we will write it down on the treatment chart of the patient as injection or infusion ring lactate 300 ml IV at 33 drops per minute. Okay, so it will be appropriate for our patient.